Did you know there's a silent killer claiming lives every 34 seconds in the United States? That's right, and it's called heart disease. Despite advances in heart technology and medicine, this gruesome menace continues to be the leading cause of death in the United States. You must monitor your health and keep an eye out for any signs that your heart may be at risk. But how do we do that? Are there any warning signs of impending cardiac issues? What are they? Today's video will answer all of your questions and more. So, without further ado, let's get started. Number 1. Have you noticed small, itchy bumps on your skin lately? This could indicate that your heart is in grave danger. These lesions can appear out of nowhere as small, waxy, yellow bumps on the skin and are often painful and itchy. These lesions are known for their distinctive appearance. In medical terms, this is called eruptive xanthoma. It's a skin condition that may manifest in various parts of the body, such as eyelids, hands, elbows, lower calves, and buttocks. The cause of this condition is hypertriglyceridemia, which is an excessive amount of triglycerides in the bloodstream. Triglycerides are fat the body uses as an energy source obtained from food. But why should we worry about high triglycerides? As we always say, too much of anything can be harmful. Too many triglycerides could negatively impact your health. When you consume extra calories, your body converts some into energy and the rest into triglycerides or fats, which get stored in various parts of the body. Hypertriglyceridemia can also lead to atherosclerosis, a buildup of fats, cholesterol, and other substances in your arterial walls. This buildup forms plaque, which blocks the continuous oxygen supply to your heart. This narrows down blood vessels by further streamlining the arteries, which increases the risk of heart attack or stroke. Studies have shown that eruptive xanthoma could also occur in metabolic disorders such as obesity and diabetes, essential risk factors that cause cardiovascular diseases. It's crucial to pay attention to new skin lesions as they could be a sign of underlying metabolic disorders, which are significant risk factors for cardiovascular disease. Number 2. Do you have a diagonal crease in your earlobe or Frank's sign? Typically, the average earlobe appears smooth, but in the case of Frank's sign, a crease appears that seems to divide the ear in half. And studies often link this creased earlobe with an increased likelihood of heart issues. But the question is, can a simple fold in your earlobe really predict an underlying cardiovascular issue? The scientific community has differing opinions on the issue, and the ifs and whys of this warning sign remain yet to be explored further. However, studies have shown that those with twisted earlobes may encounter cardiac issues at some point in their lives. One study that examined microscopic samples from those with and without Frank's sign have found that those with creased earlobes had higher heart weight, thicker cardiac walls, and severe blockages in the arterial vessel beneath the earlobe. How does this crease form in the first place? The crease usually results from inadequate oxygen supply to the elastic tissue, possibly due to the constriction in small blood vessels leading to the earlobe. This constriction is caused by plaque buildup and results in restricted blood flow. If your periphery vessels are experiencing limited blood flow, it's possible that other blood vessels throughout your body are also affected, including your coronary artery. This could increase the risk of developing coronary artery disease, potentially leading to a heart attack or stroke. In rare cases, the development of Frank's sign may be due to disorders like Beckwith-Wiedemann syndrome, an overgrowth syndrome often affecting children and has been linked to cardiac issues. Studies establishing this observation showed that 12 out of 13 people with Beckwith-Wiedemann syndrome were found to have cardiac abnormalities. Number 3. Have you noticed a slightly bluish ring around your cornea? If you're wondering why you've developed a white, light gray, or bluish ring around your cornea, the answer is underlying cardiovascular issue. This bluish ring is called arcus senilis and comprises fatty deposits or cholesterol. It begins with the appearance of short arcs at the top and bottom of your cornea, but as your cholesterol levels see a significant hike, these arcs join to form a complete ring. Did you know that arcus senilis may vary depending on your ethnicity? That's right. Africans and Southeast Asians may be more likely to develop this condition. But regardless of your race, it becomes more common with age. Studies have shown that almost all adults over 80 will likely develop arcus senilis. Although the presence of arcus senilis is clinically insignificant to a certain extent, if you're under 40 and it shows up out of nowhere, it's advisable to check your cholesterol levels. Those with arcus senilis well before their 40s are more likely to experience cardiovascular troubles due to their elevated cholesterol levels. High cholesterol levels is a long-standing enemy of your heart. It's a waxy substance that forms plaque in your arterial walls. Over time, this plaque could grow and constrict your arteries. This puts undue pressure on your heart and it starts pumping faster. Consequently, with no regular oxygen supply, it gets tired and gives up. And as we mentioned earlier, this can result in a stroke or heart failure, which could be life-threatening. Number 4. Has your skin acquired a bluish tint? If your skin, lips, or nails appear bluish, it could indicate your body is experiencing a depletion in oxygen levels. Cyanosis causes a bluish tone to your skin color. For darker skin tones, your skin may appear grayish or whitish. Cyanosis is a serious medical condition and often results from underlying heart complications. Research has often linked cyanosis to congenital heart disease, which refers to structural abnormalities in the heart and thoracic arteries. This is the most common type of birth anomaly and one of the leading causes of death in children with congenital malformations. Although the exact causes of congenital heart disease are not entirely understood, it's believed that genetic mutations or sometimes environmental factors such as maternal illnesses and exposure to toxins, viruses, and drugs may contribute to the development of these birth abnormalities. Cyanosis can manifest in 3 ways. Number 1. Circumoral cyanosis, which turns your mouth or lips blue. Number 2. Then peripheral cyanosis, which is characterized by bluish discoloration of your hands, feet, fingers, and toes. This indicates that you should seek warmth immediately to prevent the exposure to cold. Number 3. And lastly, central cyanosis. A more severe form of this condition indicates a widespread lack of oxygen or exposure to cold throughout the body. It affects the chest, cheeks, limbs, gums, and lips, and is typically associated with severe heart, lung, or blood disorders and requires immediate medical attention. Number 5. Do you feel a strange puffiness in your legs? Edema causes swollen and puffy limbs and is a common manifestation of cardiovascular issues. It occurs when the fluid balance in your body isn't functioning correctly, which might lead to an accumulation of fluids in your tissue. Gravity will also pull fluid down to your feet and cause swelling. Your legs might feel heavy, and you may encounter a pitting effect upon touching the affected areas. Peripheral edema has various causes from minor injuries to significant underlying conditions like chronic venous insufficiency. If edema lasts for a few days or weeks, medical attention is a must. Venous insufficiency is one of the most common causes of peripheral edema and affects 30% of the population. The condition happens when your veins become so weak and damaged that they cannot pump blood back to your heart effectively. Usually, the valves in your veins ensure that the blood flows toward your heart, but because of damage, they might not work well, resulting in blood pooling in your legs, leading to edema. Another reason behind edema could be the development of a blood clot. Blood clots are gel-like clumps of blood that may pose obstruction in the way of healthy blood flow. The more blood clots, the more difficult transporting oxygen throughout your body becomes. If these blood clots break free, travel, and reach your heart, they could cause a severe blockage and result in a heart attack or stroke. For whatever reason, if you're experiencing edema, it's a sign that something isn't functioning correctly in your body and should be taken seriously. To help soothe the symptoms of edema, try elevating your legs when sitting down or wearing compression stockings. Knowing the warning signs of a heart condition is crucial in monitoring your overall health. And as the saying goes, prevention is better than finding a cure. So, how can you ensure that you're steering clear of cardiovascular problems? No matter how big and deadly heart issues may seem, you can start by adopting simple lifestyle habits. Want more heart-friendly tips? Check out our video on these 12 best foods that can help unclog arteries and decrease heart attacks, or how to reverse plaque in your arteries or clogged arteries. Go ahead, click one, or better yet, watch both. What warning signs did you notice in yourself or loved ones? Let us know in the comments below.